We're doing this video about rheumatoid arthritis to help everybody out there know a little bit more about the physiology of rheumatoid arthritis and some of the complications and other things that come along with it.
So I'm Ashley, and I'm actually going to be acting as Dr. Ashley.
I'm April. I'm a real patient with RA.
And I'm Dylan, and I'll be acting as Dr. Dylan.
Hi, Miss April. How are you today?
I'm alright. How are you?
I'm good. My name is Dr. Ashley. Think you remember me from the last time. Today I did bring Dr. Dylan with me here today so that we can discuss your test results from your last visit.
Hi, it's very nice to meet you.
You too.
All right, Miss April. So after reviewing your blood tests and your x-rays from your last visit, we have concluded that you do have rheumatoid arthritis, which is also known as RA. You may have heard it called that before. You have the rheumatoid factor and the anti-CCP antibodies in your blood.
So what does this mean? I learned about rheumatoid arthritis in college, but I can't recall anything right now.
Well, let me first tell you that we have treatments available, and we can get you implemented on those right away. Arthritis broken down stands for arthro as joint and itis as inflammation. Now, rheumatoid arthritis isn't like osteoarthritis, where it actually affects more joints, and it's actually prevalent in about 1% to 2% of the population of the United States.
I just don't understand how I can have this. Isn't arthritis for old people?
No, it can actually happen in children as young as 2 years old. It's one of the most common autoimmune diseases. And basically what an autoimmune disease is that your white blood cells are attacking other healthy cells within your body.
So to give you a little bit more detail, what happens is your immunoglobulin M antibodies attack your own immunoglobulin G antibodies. The immunoglobulin M thinks that the immunoglobulin G are antigens or foreign invaders. Your B lymphocytes will produce both of these immunoglobulins.
The combination of the antigen immunoglobulin G and the antibody immunoglobulin M are also known as immune complex.
Okay, I'm starting to remember some more of this stuff. The immune complex, that's known as a rheumatoid factor in people with rheumatoid arthritis, correct?
Yeah, you're right.
Okay, in advanced physiology in college, I remember learning about immune complexes because we were told to give a damn. The immune complexes, if I remember correctly, they activate proteins and cause inflammation, and in a normal person, the phagocytic cells are supposed to stop the immune complexes from taking over, but in I guess a person like me, the immune complexes or rheumatoid factors are produced in much larger amounts, and they go all throughout the body causing inflammation. They can also cause organ damage. So I guess this is why it's known as immune complex disease, because your body's attacking itself, and since it's traveling throughout the entire body, it can infect many parts. That's why it's called a systemic autoimmune disease. Am I correct?
Wow, you're probably one of my smartest patients. The rheumatoid factors are present in the membrane of your joints, which is also called the synovium. These factors cause secretion of cytokines, which can lead to inflammation in the joint. Due to the presence of T lymphocytes along with the cytokines, enzymes are released by your body that lead to the destruction of your bone and your joints.
Wow, okay, you guys are giving me so much information. Can you just explain to me why I get stiffness in my joints?
Well, actually the white blood cells start to replace the synovium, a 1 to 2 cell layer, with a much thicker layer of blood vessels and other cells. This thick layer is called pannus, and it causes the stiffness. It also cuts off the nutrient supply to the joint and makes it much harder to repair. So I do have a few pictures here I'd like to show you, just to give you kind of an idea of what we're looking at. The right side of the picture shows the buildup of pannus, which causes the stiffness of your joints. If you compare the figure on the right to the normal joint, you will notice the inflamed synovial membrane as well as bone erosion. This can cause mild to severe pain. So April, I know we have thrown a lot of concerning information at you today. Do you have any questions for us at this time?
Well, is RA genetic? Because I don't have anybody in my family with it.
RA has both genetic and environmental factors. Some research says that almost 50% of those with RA actually have genetic components. Smoking, however, is the biggest environmental factor.
Well, I don't smoke.
Well, since you have no family history of RA or you don't have any history of smoking, it's most likely a spontaneous occurrence. Do you have any other questions for us?
Not that I can think of.
All right, Miss April. At this time, I'd like to take a look at your x-rays. As you can see here in your results, we already have some joint space narrowing occurring in your knuckles. And if you take a look down here at your wrist, bone deterioration has already begun. How are your wrists feeling today, by the way?
They're pretty stiff. This morning when I woke up, they were a lot more stiff, though.
Okay, well, I'm going to do an examination at this time. Just tell me how it feels. How about here?
That hurts.
That hurts. And how about at your knuckles?
Those aren't too bad.
Okay. And if you can just take off your shoe for me at this time, I'd like to take a look at your feet. All right, go ahead and set it up here in my lap. And how does it feel when I press here?
Yeah, that's stiff.
Pretty painful? All right, well, that is just proof that there is rheumatoid arthritis located in your hands and feet and that you're already feeling it now this early in the disorder.
Are there any other locations that you feel stiff or painful on a regular basis?
Well, my knees hurt a lot, but I didn't know if that pain was coming from, like osteoarthritis might explain it, or else it was just overworking of my joints from running.
Yes, rheumatoid arthritis can be causing the pain in your knees. Actually, if you take a look at this chart, it shows the many different joints that RA can affect.
Is there any way to stop my body from affecting like all those joints?
Well, April, we do have some wonderful treatment options for you because this disease can quickly and aggressively cause damage. In the past, studies have shown that most people who experience RA for more than 20 years actually end up significantly disabled. So today, that has changed and you can thank medical technology for that. It's best if we begin this treatment as soon as possible to prevent any further damage. Unfortunately, RA isn't curable, but with proper treatment, you will be able to live a normal life.
Actually, now that I think of it, somebody I know has rheumatoid arthritis, one of my friends, and I think she takes medications such as like methotrexate and Plaquenil and a biological response modifier known as Enbrel. I think that's a shot that she takes one time a week. And I think I'm also supposed to say like DMARDs, drug modifying anti-rheumatic like drugs, and those are supposed to stop my immune system from attacking itself, from attacking my own body. Will I have to take these medications?
Yes, you are very well informed about this. I actually do have some drugs over here I'd like to show you. First of all, we do ask you take a multivitamin daily, definitely help the immune system. Also ask that make sure you're taking your methotrexate as well as folic acid and the Plaquenil. All of those are definitely going to help to slow down the progression of the disease. And we also have here the Enbrel that you talked about that your friend uses. Basically, it's a shot you're going to give yourself once weekly, and you're going to hold it up to your thigh, push it down, and then inject the medicine in. Okay. The other thing as well that we ask that you do is if you do have a lot of pain in your wrist, go to a physical therapist and they can actually make you some braces that look like these. They definitely help and they're good for sleeping at night so you don't bend them one way or the other too much and don't cause too much pain. Again, all of these medications here are definitely going to help.
We also suggest that you take some over-the-counter NSAIDs such as ibuprofen for inflammation and analgesics such as Tylenol for pain if needed. We also suggest that you modify your diet and exercise daily. And Dr. Ashley will give you a pamphlet later on that will talk more about these suggestions. And we also have books here that if you would like to read, we'll talk more about your condition. Do you have any more questions for Dr. Ashley and I?
No, I don't.
All right, well, if you do have any other questions at any time, don't hesitate to call the office. Here's your prescription here, just wrote it up. Please follow our suggestions and set up an appointment about 2 months from now. We will need to see you at least every 3 months to get some blood work. So any other questions at all?
No.
All right, well, you do have a wonderful day. Again, feel free to call if you need anything.
Thank you.
You're welcome.
And special thanks to our videographer, Casey.